My name is Charles Grabel, and I have Tourette's. When I tick, I usually have lots of screaming tics and motor tics, such as clapping my hands and sometimes punching my leg, and they can get pretty uncomfortable sometimes. Sometimes I bruise myself a little bit, and yeah, some of them hurt, but I also have worked a little bit on habit reversal therapy, which involves having a competitive response, which is something that you do while you're having an urge.
I'm Greg Dockler, and I have Tourette syndrome. Some of my main symptoms have been a chronic cough, squeaking, sniffling kind of tic. A lot of them have to do with vocalization, throat clearing, stuff like that. And some of the methods that I've used to help deal with those are, I meditate a couple times. There's a thing called guided imagery, which helps you to visualize places that you like to go, and it calms you down. Rhythmic breathing also helps a lot because it calms your nervous system down and it lets you focus on what you're trying to do. And I found that those are really helpful for all manner of tics, whether they be motor tics or vocal tics.
By definition, to meet criteria for Tourette's disorder, the child must have multiple motor and at least one vocal tic that have been present for greater than 1 year. There are no laboratory studies or neuroimaging studies needed. The diagnosis is made on the basis of the classical history. Tourette's disorder is often accompanied by other neurodevelopmental and neuropsychiatric disorders. For example, many children may meet criteria for attention deficit hyperactivity disorder, also known as ADHD, or obsessive compulsive disorder, also known as OCD.
Co-occurring disorders are very common for individuals with Tourette syndrome. For individuals with Tourette syndrome, co-occurring disorders such as ADHD, OCD, anxiety disorders, or depression are very common and can cause significant impairment in day-to-day life. For some people with Tourette syndrome, the impact of these co-occurring conditions can be more impairing than the tics themselves. So if you're experiencing any other symptoms such as low mood, anxiety, nervousness, irritability, sleep problems, or other symptoms that you're worried about, it's very important to talk to your healthcare provider. There are very effective treatments for co-occurring conditions such as OCD, anxiety, ADHD, or depression. These co-occurring conditions have highly effective, evidence-based, research-supported treatments, such as cognitive behavioral therapy, medication, or the combination of the two. Most studies suggest for moderate to severe symptoms, the combination of cognitive behavioral therapy and medication is the most effective treatment. Talk to your provider about how to access these treatments, and for those people who don't have access to evidence-based treatments in your area, there are helpful bibliotherapy or online resources that you may be able to use.